So a lot of patients do come to me with a lot of different questions and a lot of misconceptions about varicose veins. A lot of them come to me and say, well, these are cosmetic. It doesn't matter if they're small or large. And in their minds, they think they're cosmetic, they think it's not covered by insurance, and they don't think they will be causing them a problem. The reality is varicose veins are a true medical condition. Insurances do want you to get them treated. They cover the diagnostic portion of it, which is done by ultrasound, and they cover the treatment portion, which is typically done with laser. You might have varicose veins sticking out, you might have leg pain and not associate the two. But people with varicose veins, when they come to see me, will complain of one or more of the other. Aches, pain, tenderness, crampiness, heaviness, fullness, tiredness, restlessness, itchiness, burning, swelling, the list goes on. A lot of people like to ask, if left untreated, what are some of the serious problems that can occur if having varicose veins? Well, there are many, and I've gone over, you can get the cellulitis, which is the inflammation of the legs, you can get the hardening of the skin, which is dermatosclerosis, and then you can get non-healing wounds, which we call ulcers. These are very debilitating and very painful. Now, some of the more acute problems, or the main acute problem that you do not want to get, is something called a thrombosis of the varicose veins. So we call it a superficial venous thrombosis. So it's a clot in the varicose veins. Varicose veins like to clot off because it's standing blood. The blood is pooling in these veins. Now, they had a recent study that they published in the Journal of American Medical Association back in February of 2018, and they found that patients with varicose veins have a 5.3 times higher chance of getting a DVT, a deep venous thrombus, versus patients that do not have varicose veins. This proves that having varicose veins is completely not a cosmetic issue. This is a true medical problem. A lot of people come in and ask, how do we get rid of varicose veins? A lot of people still think that there's some sort of surgery involved, and it's not like that anymore. What I focus on is something called endovenous laser ablation. Endovenous means within the vein. Laser, we're using a laser energy source, and ablation is we're ablating the vein, we're sealing it and destroying it that way. So this is a catheter-based procedure, there's no cutting. It's an outpatient procedure. You need someone to drive you home, however, and it's done under local anesthesia. So the three things I want patients to realize about varicose veins is this. Number one, it is covered by insurance, the diagnostic portion and the treatment portion. Number two, the treatment is outpatient. It's not surgery. We use lasers and catheters. Very little downtime. You can go to work afterwards, just with some restrictions. And number three, if left untreated, these can lead to chronic debilitating diseases and even blood clots in the legs, which can be fatal if